has moved us ahead in that race. But now, with the new Omicron variant, we have to work even harder to stay ahead. Since last week, we've learned two things about this variant. The first is that no variant of COVID-19 has spread this fast. There are now 4,713 confirmed cases of Omicron in the UK. And the UK Health Security Agency estimates that the current number of daily infections are around 200,000. While Omicron represents over 20% of cases in England, we've already seen it rise to over 44% in London, and we expect it to become the dominant COVID-19 variant in the capital in the next 48 hours. There are currently 10 confirmed people in England who have been hospitalised with Omicron. It's vital we remember that hospitalisations and deaths lag infections by around 2 weeks. So we can expect those numbers to dramatically increase in the days and weeks that lie ahead. In preparation, the UK's 4 chief medical officers raised the COVID alert level to 4, its second highest level. This was done over the weekend. And NHS England has just announced that it will return to its highest level of emergency preparedness, level 4 national incident. This means the NHS response to Omicron will be coordinated as a national effort rather than led by individual trusts. The second thing that we've learned in the past week, Mr. Speaker, is that 2 jabs are not enough to prevent symptomatic infection from Omicron. But a third dose, a booster dose, provides strong protection, with analysis by the UK Health Security Agency showing a third dose is 70% effective at preventing symptomatic infection, and we expect the booster to take effect more quickly than the second dose. We're already running the most successful booster campaign in Europe. Over 4 in 10 UK adults have now received a third dose or booster. And Saturday was a record, with over 500,000 boosters given across the UK. But, Mr. Speaker, with the race between the virus and the vaccine so close, we must move faster. 2 weeks ago, we announced that we would offer every eligible adult a booster by the end of January. But in response to the Omicron emergency, and as the Prime Minister announced yesterday evening, we're bringing that target forward by a month and launching the Omicron emergency boost. We've opened the booster programme to every adult who's had a second dose of the vaccine at least 3 months ago to offer them the chance of getting their booster before the new year. So from this morning, anyone over 18 can walk into a vaccination centre, and from Wednesday, they can book online via the NHS website. The UK government will also provide whatever support is needed to accelerate vaccinations in Scotland, Wales and Northern Ireland. We have the jobs. The challenge now that we have the jabs. The challenge now is to get them into the arms. To meet our ambitious target, the NHS will need to deliver a record number of jabs. Until now, the highest number of jabs that we've delivered in a single day in the UK was over 840,000. We'll not only need to match that, but we will need to beat that every day. But we can, and we've got a plan to try and do it. We're opening more vaccination sites, including pop-up and mobile sites, that will be working 7 days a week. We're training thousands more volunteer vaccinators. We're asking GPs and pharmacies to do more. And we're drafting in 42 military planning teams across every region of our country. Mr. Speaker, this collective national mission will only succeed if we all play our part. Those who haven't had their booster should find their local walk-in and vaccination centre, or they can book an appointment on the NHS website from Wednesday. Those who have had their booster jab should encourage their friends and family to do the same. Those who have or have recently had COVID should wait 28 days from their positive result to get their booster. And to those who haven't had their vaccine at all yet, Mr. Speaker, I would like to say this. Whatever has held you back in the past, please think again and book your jab as quickly as possible. By acting together to get boosted now, we can protect ourselves against Omicron this winter. Mr. Speaker, I acknowledge that our national mission comes with some difficult trade-offs. We are redeploying NHS staff away from non-urgent services. This means that, for the next 2 weeks, all primary care services will focus on urgent clinical needs and vaccines, and some urgent appointments and elective surgeries may be postponed until the new year, while we prioritise getting people the booster. These are steps that no health secretary would wish to take unless they were absolutely necessary. But I'm convinced that if we don't prioritise the booster now, the health consequences will be far more grave in the months that lie ahead. Mr. Speaker, our Omicron emergency boost is a major step, but I'm not going to pretend that this alone will be enough to see us through the difficult weeks ahead. Because of the threat of Omicron, we are moving to Plan B in England, subject to the will of this House, meaning that we must use face coverings in indoor public places. People should work from home if they can, and from Wednesday, again subject to this House, you'll need to show a negative lateral flow test to get into nightclubs and large events with an exemption for the double vaccinated. Once all adults have had a reasonable chance to get their booster jab, we intend to change this exemption to require a booster dose. Even with Plan B, Mr. Speaker, we still have far fewer restrictions in place than Europe. I can also confirm, Mr. Speaker, that from tomorrow, fully vaccinated contacts of a COVID-19 case will now be able to take a daily lateral flow test instead of self-isolating. This is a vital way to minimise the disruption to people's daily lives and to avoid the so-called pingdemic. And I can assure this House that the UK has sufficient lateral flow tests to see us through the coming weeks. If anyone finds that they are unable to get a kit online, they should check the website the following day, or they can pop down to the local pharmacy and pick up a kit. And from today, I can confirm that the NHS COVID Pass is being rolled out to 12 and 15-year-olds for international travel, allowing even more people to be able to prove their vaccine status for travel where it is needed. From today. Mr. Speaker, Mr. Speaker, taken together, these are proportionate, balanced steps keeping the country moving, while slowing the spread of Omicron and buying us more time to get more boosters into arms. We're also taking steps to keep people safe in adult social care. And we know that, sadly, people in care homes and those who receive domiciliary care are more likely to suffer serious health consequences if they get COVID-19. So we're expanding our specialist vaccination teams to get more boosters to the vulnerable and those providing care. But even as we do so, we must go further to protect colleagues and residents from Omicron. So we are increasing the frequency of staff testing and, with a heavy heart, we must restrict every resident to just 3 nominated visitors, not including their essential caregiver. This is a difficult step, and I understand that it comes with an impact on physical and mental well-being. But we know that from previous waves that it's one of the most effective things that we can do to protect vulnerable residents. We are also increasing our workforce recruitment and retention fund with £300 million of new money. This is in addition to the £162.5 million we announced in October. The funds will help pay bonuses, bring forward pay rises and for the care staff, and fund overtime and increase workforce numbers over the winter. Mr. Speaker, I know that honourable members had hoped that the days of this kind of COVID-19 update were behind us. After our successful reopening this summer, it is not an update that I wanted to deliver. But the renewed threat of Omicron means that we've got more work to do to stay ahead of this virus. We can if we all play our part, and boosters are the key. We've achieved so many phenomenal things over the last 2 years, and I know we are weary, But it's on all of us to pick up, to step up and do some phenomenal work once again to play our part and to get boosted now. I commend this statement to the House.
Can I suggest to the Secretary of State we could be a pop-up site for all the staff that work here to get them boosted? Can I now come to the Shadow Secretary of State, West Streeting?
Thank you, Mr Speaker, and can I thank the Secretary of State for advance sight of his statement. Today, Mr Speaker, we learned of the first death in the UK as a result of the Omicron virus. So on behalf of the whole House, can I send our condolences to the friends and family of that person who's lost their life. Their death sets this statement and the task at hand in context. It is a stark reminder that the pandemic is not over, that the new variant is a clear and serious risk to our public health, and of the urgency of getting Britain boosted and protecting us against this threat. Mr Speaker, the Labour Party will always act in the best interests of our NHS, of our public health and of our nation. Having repeatedly called for the booster programme to be ramped up, we will give our full support to this effort. And we on these benches will make every effort to get the message out that vaccines are the best tool we have at our disposal to protect ourselves, to protect those closest to us and to protect our NHS. The target of getting 1 million people a day their booster vaccine is unprecedented and it may even prove impossible, but we applaud the ambition. If anyone can do it, the NHS can, and the whole country will be willing them on and will not knock them for trying. What people will not accept is the government moving the goalposts. The Prime Minister is now famous for over-promising and under-delivering. In his televised address last night, he said, and I quote, "People will have the chance to get the booster before the new year." But that aim is instead, as we've heard from the Secretary of State, is to offer the booster to every adult by the end of the month, meaning the delivery will wait until January or even February. Is the government now rowing back on the target set yesterday? If so, why has it changed overnight? And what hope do we have of achieving the level of booster jabs we need if the public and those delivering the vaccines are told one thing one day and another the next? The Prime Minister has got to learn to be straight with people because he is undermining public trust and confidence in the government and public health measures at a critical time. Can I also ask what discussions the Secretary of State has had with local authorities, GPs, pharmacies and other delivery partners who will be crucial to this effort? Then there is the shambles of testing. I must say, Mr Speaker, I thought the Secretary of State might be living on a different planet when he described the availability of testing, because the government's website today states that home testing kits are currently unavailable, pharmacies across the country are out of stock, and even here in Parliament there are no home testing kits available from Portcullis House. No doubt this is due to a surge in demand ahead of the new testing requirements this week, but surely that should have been foreseen. And this is a serious problem. Those coming into contact with positive Omicron cases will not be able to follow the rules and get themselves tested on a daily basis. Those who require tests to undertake home visits risk being left short. Many others need them for work. So how does the Secretary of State plan to ensure there are enough tests in stock and available to everyone who needs them when they need them? And when will this be resolved? It doesn't appear the Secretary of State was even aware of the problem. Absent from the Prime Minister's address last night was any plan to speed up the vaccine rollout for 12 to 15-year-olds. On current trends, some teenagers won't receive their vaccine until February, 5 months after the government's initial target of October half-term. Children have already faced significant disruptions to their education. So will the Secretary of State update the House on the vaccine rollout for 12 to 15-year-olds? Will they receive their vaccines by the end of the Christmas holidays, as we've called for? And of course, Mr Speaker, patients will be concerned by the news that appointments will be delayed to accommodate the booster rollout. There is no doubt that the booster programme is the right priority. If we don't get ahead of Omicron, the pressure on the NHS will be unbearable and the disruption to people's appointments in the new year will be severe. But let's be honest, Mr Speaker, the challenge is made so much greater as a direct result of the government's mismanagement of the NHS for 11 years. We went into the pandemic with record waiting lists, six-figure staff shortages in the health service and the care sector. So where is the NHS workforce plan? Where is the plan for recovery of elective care? And why can this government not understand that their continued failure to fix social care is piling even more pressure on the NHS at the worst possible time? And on social care visits, Mr Speaker, can I ask the Secretary of State to think again about limits on care home visits? This feels like the wrong decision at the wrong time. Mr Speaker, I'd like to conclude, if I can, with some words directed to the public. We realise on these benches that the Prime Minister has tested patience by asking people to follow the rules when Number 10 didn't. The Prime Minister's actions in recent weeks have undermined trust at a critical moment. So I say to people feeling let down or lied to that I do trust the Chief Medical Officer, I do trust the Chief Scientific Advisor, and I do trust the NHS. The Prime Minister might not lead by example, but the rest of us can. And we, the Labour Party, trust you, the British people, to do the right thing, to protect yourselves, to protect the ones you love, and to protect the NHS.
Mr Speaker, first of all, can I say I heard your request at the start, and if it's okay with you, Mr Speaker, that's something I'm happy to take up with you directly. Can I thank the honourable gentleman for his support of the need to accelerate the booster programme, and can I also join him in, I'm sure that as the whole House does, to express condolences for the individual that has been the first in this country to die with this new variant, Omicron. Turning to the honourable gentleman's questions, first the honourable gentleman has asked about the testing capacity. And I would actually like to share more information with the House. There is no shortage of actual tests that are held by UK HSA. There are millions, tens of millions of tests in stock, millions arriving each week. The issue, the limiting factor because of the hugely increased demand, and I'm sure members can understand why demand has suddenly surged, is the ability to deliver the tests and having enough capability to deliver the tests because the current arrangements with Royal Mail alone are not enough. There are new arrangements that are reached with Amazon and other delivery methods, and what that means, there will still be many 100,000 record number delivered each day, but also the number of access points is being increased, including many more through pharmacies and rapidly looking at other access points. I think the honourable gentleman is right to raise this, but I hope he and other honourable members understand there's been a huge surge in increase, and it's not just about the number of tests that are available, it's about getting them through and delivered, both equally important. The other issue the honourable gentleman raised was about the booster programme itself and the timing of that programme. And he's right that just a couple of weeks ago, the plan was to get everyone a boost. This was after the change in advice from the JCVI to reduce the dosing gap to 3 months, and their advice that it should include now everyone over the age of 18. If the plan was to do that by the end of January, for the reasons that I've explained and the Prime Minister shared in his national broadcast yesterday, we want to bring that forward. And what this is working hard with the NHS, and the NHS, by the way, has done absolutely phenomenal work already to reach 4 in 10 adults with boosters and with their vaccination programme in general. It is asking a huge amount of our colleagues in the NHS, and it is our joint view that we can try to offer adults a chance to get boosted by the end of this month. And that does not mean every single person necessarily can get that boost. It requires them to come forward and to take up this offer as well as everything going right in this huge expansion plan. But again, I hope that the honourable gentleman can respect that the NHS is doing everything it can with the full support of every department of government to throw everything at this to offer as many opportunities and the maximum possible capacity that there is for delivering on that commitment. The Honourable gentleman also talked about the NHS in terms of the challenges that it's facing. I would like to remind him and the House that this year the government has put in an extra £34 billion into the NHS and social care, £5.4 billion of that in the second half of this year, and over the next 3 years there's a commitment to at least £8 billion extra into the largest catch-up fund the NHS has ever seen. In the last year, we've seen almost some 10,000 nurses join the NHS, almost 3,000 doctors. The NHS is increasing workforce, it's increasing capacity, it's looking at new ways to do electives, and it's putting a huge amount of effort into its electives programme and its non-COVID work as well. And then lastly, on adult social care and the limit to visitors, I do understand what the honourable gentleman has said, and it is important, I think, to get the balance right here. We all know the problems and the sad deaths that we saw in care homes with this pandemic not that long ago, and it is right to take balanced measures to protect people in care homes when working and listening with those people that run our care homes, and to try to take a balanced approach that allows visits to take place, but it also protects those individuals that are so vulnerable.
Chair Select Committee, Jeremy Hunt.
Thank you, Mr. Speaker. 1 year and 5 days ago, the UK administered the first properly approved COVID vaccine in the world, and the government is absolutely right to focus its strategy on immunisation. But Israel approved booster jabs for all adults in September. France approved jabs for teenagers in June, both long before us. The United States has already approved jabs for 5-year-olds, again long before us. Is he worried that our regulators, having been the nimblest in the world, are now taking too long? They are brilliant scientists, they are rightly totally independent, but what can he do to speed up this crucial decision-making in a pandemic?
Mr. Speaker, my right honourable friend makes a very important point with experience, and I think it's fair to say we can be proud of so much of what our regulators have achieved and what they've done. And as he has said himself, we were the first in the world to approve a COVID-19 vaccine. But he's also right to challenge on this and ask what more can be done, especially in light of the circumstances we face. I hope my honourable gentleman can also commend how JCVI, since the emergence of Omicron, and I know they're not a regulator, but they're an important part of the approvals process, about how quickly they reacted in changing the rules around boosters as soon as we learned about Omicron.
We now come to SNP spokesperson Alan Brown.
Thank you, Mr. Speaker. It's worth putting on record that Scotland is the most vaccinated nation in the UK, and certainly would encourage everybody to continue to take up uptake of the booster. Now, does the Secretary share my outrage that his backbenchers last week were literally cheering the proposition that he needs to wait until more people are hospitalised before they'll countenance the wearing of masks in public places? It's absolutely reckless, and it sends the wrong message to the public when they're trying to tell them to take the risk of Omicron seriously. Now, tragically, we know people are now being hospitalised, and we've already recorded, sadly, 1 death from Omicron. So, based on evidence elsewhere, what kind of upward trajectory does the Secretary think there's going to be in terms of hospitalisation? And why the Plan B measures being brought forward, which are already in place in Scotland, is there a pub exemption? Because that makes no sense. Now, given LFTs are only 50% accurate, what risk implications has he assessed in terms of using LFTs to keep people from self-isolating? Surely he needs to consider the minimum being a PCR test and follow the more cautious approach being adopted by the Scottish Government. And why, when LFTs is their key guidance, have they put themselves in this ridiculous position of their website saying they've run out LFT kits? Now, Mr. Speaker, if we're talking about supporting people to self-isolate, then we really need to revisit and extend the levels of statutory sick pay. And so what discussions is the Secretary having with the Chancellor and the DWP Secretary about this? And critically, does he support calls from the devolved nations that they need Treasury support to put in place what restrictions they believe are required to control the spread and impact of Omicron and support livelihoods at the same time? The Scottish Government has already put in place a more generous rates relief to the hospitality industry than the UK Government did, but with trade dropping, Suppliers and the trade itself need further support, especially if further restrictions are required going forward. So will I take this up with the Chancellor, and also is the Cabinet considering support for the travel industry? Does he agree that targeted sector restrictions with full financial support is a better long-term strategy rather than the all-or-nothing type approach that we seem to be, and praying that the booster programme alone will be sufficient, because it's going to need a lot more work than just that alone?
Mr. Speaker, the honourable gentleman is right to point to the lag between the point of infection and hospitalisations, and that I think emphasises the need to act early and to act strongly, and that's why the booster programme and that response is so important in Scotland, in England, throughout the UK. It is good that all 4 nations are working very closely together on that. On the lateral flow tests as a way alternative to self-isolation, I think lateral flow tests are the right approach. They can be taken daily, so that individual is tested each day for 7 days, where PCR will be a single test at a single moment. And I just think it's much more flexible, and it's something that's based on advice that ministers have received. And in his questions around economic support, that's something we keep under review.
Andrew Lenson.
Thank you, Mr. Speaker. I do congratulate the government on the rollout of the vaccination programme. It is impressive. But what does my right honourable friend say to my constituent who says she is now less afraid of COVID than she is of intrusive and incoherent government regulations?
I would say to my right honourable friend that I hope her constituent would appreciate that the government has to act on the information that it sees before it in terms of the spread of this new variant, the rate of spread, the information we now know about its degree of vaccine escape, not just to protect her constituent, but also to protect her constituents' loved ones and her community.
Barry Sherman.
Deputy Speaker, can I say to the Secretary of State, I was deeply shocked when he was in this House recently, and when I said all sensible members of Parliament will be supporting any measure to save lives, and I had boos and catcalls from the government benches. Can I repeat my view that does he realise what a great potential we as members of Parliament in our communities, working for this, rolling our sleeves up, working cross parties with local councillors and local volunteers. This is a real resource, this House of Commons. Please, please, will he use us effectively?
Mr. Deputy Speaker, can I thank the honourable gentleman for his call for all members to do their bit to help the nation at this time of crisis. And it's not just what we can all do in this House, but I'm sure he'll agree it's what we can do in our local communities.
Robert Halfon.
Thank you, Mr. Deputy Speaker. My right honourable friend rightly talks about protecting the NHS, but could I ask him if he will ensure that we protect our children as well, and make sure that the schools are kept open in January, that the government sets out a plan for keeping the schools open in January? And given that the Sunday Times suggested that primary school children were going to be vaccinated, will my right honourable friend come in and make a statement, or the Department for Education Secretary of State make a statement about this vaccination programme for younger children, and ensure that there is 100% parental consent?
First of all, Mr. Deputy Speaker, can I agree with my right honourable friend on the importance of protecting our children? And we all know now in this House that how children have suffered throughout this pandemic, and the impact there's been on them, their education, their mental health, their socialisation with other children, and many others. And he's right to talk about that importance. And one of the reasons to take the measures that we've said, especially around the expanding the booster programme, is to make sure we can prioritise our children. On the issue of vaccination for younger children, for 5 to 11, that is something that the JCVI is considering. When the government does hear back from the JCVI on that, that is something, of course, the government will bring to the House.
Sir George Howard.
Thank you, Mr. Speaker. Can I welcome the Secretary of State's statement and having listened to it and studied the matter in some detail over the weekend, I will be supporting the government tomorrow night with the measures they're introducing. But what would the Secretary of State have to say to those out there in the community who are saying, if the government, the rule makers, can't be trusted to obey their own rules, why should we?
First, Mr Deputy Speaker, can I thank the honourable gentleman for his support? And I think it's always important to emphasise that these rules, whether what we're discussing now, all rules of any type really, but obviously he's talking about rules around the pandemic, they are there for all of us and they equally apply to all of us.
Hugh Merriman.
Thank you, Mr Deputy Speaker. GPs, particularly those in rural areas, find it difficult and challenging to be able to deliver the booster programme. We'll have to deliver in great numbers. Would the Secretary of State look at measures which will actually speed through the flow for those GP surgeries, and will he also send a message out to all patients out there that they will need to be understanding over the next couple of weeks and ensure that the morale of our GPs who work so hard is not undermined?
Well, first of all, Mr Deputy Speaker, my honourable friend is right to talk about how hard GPs have been working throughout this pandemic, but also about the need to provide greater support. We expect them and would need them to help with this big new vaccination effort. And I do think there are already signs of many people showing how they understand the need for GPs to reprioritise over the next couple of weeks, and that's important too.
John Speller.
Thank you, Mr Deputy Speaker. And it's clear from the Secretary of State's statement that he's a considerable improvement on his predecessor. So I'm sure he accepts that COVID is now endemic and variants will probably be returning for years, if not decades. In that case, surely by now, instead of the erratic response we've seen, we should have a well-prepared plan of action and chain of command ready to be activated as soon as a new variant is detected, as well as enough supplies and trained personnel to operate it. So why does his department seem to be continually surprised by the arrival of variants, and instead of a smooth-running plan, we have chaos and panic?
Well, Mr Speaker, there are going to be variants of COVID-19, as the honourable gentleman says, for many years, and indeed there have been many hundreds of variants. And there is no country in the world that is better at surveillance of those variants. May I remind the honourable gentleman that it was the UK that alerted the world to the threat of Omicron. There is no country that is better prepared. If you look at how quickly and swiftly the UK reacted, for example, with its international restrictions, the information we shared with the world on vaccines. So I think the honourable gentleman understands those points. I regret the way he's framed his question.
Steve Brine.
Very much, Mr Deputy, and I thank my honourable friend for his statement. Many of my constituents will be very surprised indeed to hear from this morning anyone over 18 can walk into a vaccination centre. I wonder if he might give me an update on the Hampshire situation. But could I ask him about the NHS COVID pass being rolled out to 12 to 15-year-olds, which is such a welcome announcement and something that the Secretary of State promised this House that he'd bring back, and I thank him for that. How exactly will that work? Many of my constituents will be travelling within the next few days, certainly within the next week over Christmas. How exactly will they be able to access this pass, given that they cannot access the NHS app the same way as adults can?
Yeah, I can thanks my honourable friend for what he said, and he's right that this is around the COVID pass. It's a very important issue. We will be publishing shortly on the website exactly how that would work, but it's being rolled out as a digital pass in the same way it's working for adults starting today.
Toby Perkins.
Thank you very much indeed, Mr Deputy Speaker. The Prime Minister addressed the nation yesterday, but what he hasn't done is address the NHS in the same way. When I spoke at 4 o'clock to Derbyshire, they were unaware of, they had had no system letter from the Department of Health around prioritisation of vaccines. They were unaware about whether the quality outcomes framework payments were suspended. They were unaware about the Winter Access Fund obligations that they had now been suspended. So can the Secretary of State make sure all of our health providers are informed about these crucial matters that actually give reality in terms of their delivery of these really important messages that he's got in terms of the funding and the priorities that there are for the National Health Service.
Secretary Sajid.
Yes, Mr Deputy Speaker, the Honourable Gentleman will appreciate it's a very fast-moving situation. The NHS made the final decision to go on this expansion and the booster programme that I referred to earlier yesterday, and the system letter has gone out today.
Ian Duncan-Smith.
Mr Deputy Speaker, can I just say to my right honourable friend that it's welcome that he comes here today, but I'm concerned a bit about the mixed and heavy messaging coming from the government. The unintended consequences of that can be dire. I noticed, as my honourable friend, the chairman of the Education Select Committee, the Centre for Social Justice produced a report about the huge damage to young children, particularly in the poorest communities, when schools start locking down and shutting them out. Can he please ensure that the message is clear to them that they are not to lock down? And secondly, when I spoke this morning to GPs in my constituency, I asked them, what is the one thing you would like the Secretary of State to do now if you've got to get all these people through? And they said, do we really need to have the 15-minute wait? Can we end that and we would triple our way through this and you would get it going straight away? So can you please act on that now?
First of all, Mr Deputy Speaker, can I very much agree with my right honourable friend on the importance of never losing sight of unintended consequences. He points to an excellent report by the Centre for Social Justice that looked at that from the past actions that have been taken, and that is certainly not lost on me or my colleagues in government, but he's right to highlight that to the House once again. I hope he does agree, though, with the measures that we've set out so far. They are measured and they are proportionate, and the focus should be on the booster campaign, because that is our way out of this. On the 15-minute wait that my right honourable friend refers to, it is being very actively looked at, and I will have something more to say on that, I'm sure, very, very shortly.
Barbara Keeley.
Thank you, Mr Deputy Speaker. The Secretary of State says that there are millions of tests available, but only 9 local authorities out of 153 across England have access to a float stock of 500 PCR test kits to use at their discretion using local knowledge to tackle COVID clusters before they become significant outbreaks. This is very important to disrupt outbreaks and slow down transmission, but it's not available outside those 9 pilot local authorities. Given the importance of slowing down transmission of the Omicron variant, will the Secretary of State agree to authorise the same float stock of 500 PCR test kits to every Director of Public Health and every area to give them the tools they need to fight this variant?
Mr Deputy Speaker, can I say to the Honourable Lady, when I was referring to tests earlier, it's the lateral flow test. I think she's asking me about PCR tests, and I will look into what she said.
Esther McVeigh.
Thank you, Mr Deputy Speaker. Last week's Ofsted report was damning about the impact lockdown has had on our nation's children and the immense harm its students have suffered, with the Children's Commissioner saying schools shouldn't close again. However, it seems that the government has left the door open to school closures after the Christmas recess. So can I ask what specific conditions would need to be met for schools not to open in the new year?
Mr Speaker, I welcome the question from my right honourable friend, and what I would say to her is that with the risk that we see from Omicron at this point in time, with the rise in infections, the increased risk of hospitalisation, the information we have on the vaccines, we think we have taken the appropriate response. It's a balanced and measured set of response. It is designed to protect so much that we love in our country, especially the interests of our children. But the most important thing now to focus on is the booster programme.
Paula Barker.
Thank you, Mr Deputy Speaker. And first of all, I'd like to say that I encourage everybody to be vaccinated and also to have the booster jab. And I'm delighted that the Secretary of State has moved away from passports to having an LFT test if they can't show their COVID pass. And I'd like to thank our front bench for the work that they've done as well. My question is this, Secretary of State. You have talked about the incredible work the NHS is doing and what it will do over the next few weeks. So will the Secretary of State pause the plans he has for mandatory vaccination of all NHS workers and have the conversations with the trade unions and come up with a plan for this to be by consent rather than mandatory?
First, Mr. Deputy Speaker, yeah, I agree with her objection. I think the lady had to vaccine passports. That would be a requirement for people to be vaccinated to enter a venue, a high-risk venue. I think it's important that we focus on a test requirement with an exemption if you happen to have the right level of vaccination. In terms of her question on NHS mandatory vaccination, however, I am afraid I have to tell we won't pause what we have already announced, not least because, and this is the view of the NHS leadership as well, not least because Omicron has made it even more urgent that we continue with it.
Sir Edward Lee.
4 weeks ago, I raised the matter of a family member who is aged 90, completely bedbound, vulnerable, at home, still no booster jab. I was promised action, nothing has happened, he's still waiting. And I understand now that there are potentially hundreds of thousands of very old, very vulnerable people trapped in their own home, still waiting for the booster jab, with carers coming in and out all day, and yet we are now offering booster jabs to 18-year-olds who have virtually no chance of falling seriously ill. This is an absurd situation caused by massive delays, bureaucracy, and this ridiculous rule that a doctor has to come and a nurse have to wait 20 minutes with the old person, although there's virtually a minuscule risk of there being any harm. So we need action this day. These people are in danger of dying. Will the Secretary of State now act on behalf of very old people trapped in their own home?
My honourable friend is absolutely right to raise this, Mr. Deputy Speaker. Those that are either in care homes, they're homebound, though they have been prioritised. So, for example, I can tell him with care homes, I believe that as of the end of November, 97% of care homes were visited by GPs or other primary care teams to deliver vaccinations. And in cases where they couldn't be visited, it's because that care home itself had a lockdown and they will all be revisited again and again. I know my honourable friend has asked me specifically about people that are homebound. The same approach is being taken, and we will absolutely ensure that every single one of those people, as he rightly says, they are more vulnerable than others. They get the visit and they get their booster jab.
Anam Kaiser.
Thank you, Mr. Deputy Speaker. I had a busy weekend. On Saturday, I got my booster jab from Margaret, a hard-working staff member from NHS Lanarkshire, and I highly encourage everyone to get jagged and boosted. Then yesterday, I met with my honourable friend for East Dunbartonshire. She is a hard-working and dedicated member of this House, and it is an utter shambles that she is unable to speak and vote. She is, however, doing a power of work in her constituency, is an absolute inspiration for all of us. With the danger of this new variant, will the Secretary of State agree that this House should follow the lead of the Scottish Parliament and move to virtual or at least hybrid proceedings? This could protect vulnerable members, their families, and set a positive example of working from home.
Secretary of State.
Mr. Deputy Speaker, that is not a matter for my department.
Mark Harper.
Much, Mr. Deputy Speaker. You'll be aware, Mr. Deputy Speaker, that a couple of days ago the Department of Health published some social media, rather jumping the gun on the decision the House is being asked to take tomorrow. And very welcome, the Secretary of State intervened and said no law is decided until Parliament votes on it, and he arranged for that graphic to be deleted. Now, of course, that's not entirely true, because most COVID laws have come into force before Parliament's voted on them, including the mask mandate. However, the question I wanted to ask the Secretary of State is this. The Prime Minister refused 3 times this morning to rule out further restrictions being taken before Christmas. I'm not going to ask the Secretary of State to contradict the Prime Minister at all, but what I am going to ask him is this. If the government does decide to announce further restrictions before Christmas, or indeed after Christmas, can I have an assurance at the dispatch box that this House will be recalled to debate and vote on those measures? It's not acceptable to keep governing this country by decree. Absolutely right. You've got to involve members of the House. I agree with what the honourable gentleman said. Use members of Parliament, which means involving us in the decision, getting this House to make the laws, and then you'll find there'll be much more of a team approach to this, rather than decrees and late-night television addresses without taking the House seriously.
Secretary of State.
Mr. Speaker, first I'd say to my right honourable friend that there are no plans that I am aware of for any further restrictions, and what we are focused on is what I said to this House at this dispatch box last week, that's coming to a vote, and subject to the will of the House, we will see if those become the regulations. In terms of his further question about an assurance, that is something I will take back to my right honourable friend, the Prime Minister.
Daisy Cooper.
Thank you, Mr. Deputy Speaker. 18 weeks ago, on the 9th of August, I asked the government what assessment they had made of using community pharmacies. The response in full was that no assessment had been made. 9 weeks ago, 22nd of October, I asked the government if COVID-secure transport would be available for the clinically extremely vulnerable so they could go to their booster jab appointments. The government said it had made no assessment. 6 weeks ago, I asked the government for guidance for the clinically extremely vulnerable. I asked them to sort out the problems and the confusion amongst third primary doses and the booster jab. And 2 weeks ago, on the same day that the BMJ published data saying that Omicron was more transmissible, I asked the government whether it would renew contact tracing funding for local authorities. A week later, it said it was still assessing it. So my question, Mr. Deputy Speaker, is will the Secretary of State apologise for the shocking levels of complacency in rolling out the booster programme over the last 4 months, and will he now apologise to all those patients who will have their treatment cancelled as a result of these new announcements?
Secretary of State.
No, Mr. Speaker, Mr. Deputy Speaker, I won't apologise for speeding up the booster programme to protect the health of the British public, and I won't apologise for asking the NHS to make it a priority. If the Honourable Lady believes that we should not be vaccinating people in this country, why doesn't she just say so?
Dr. Julian Lewis.
Thank you, Mr. Deputy Speaker. It's previously been suggested more than once that when deaths with COVID are announced daily, it should simultaneously be stated how many of them were of unvaccinated people or of people with underlying health conditions or other specific vulnerabilities. Will he now undertake to do that? And did he notice, as I and no doubt others did, that the Prime Minister stated this morning that one person in the UK had died with Omicron COVID, but the Shadow Secretary of State said it was as a result of that virus? Does he know which of those two versions is correct?
Mr. Deputy Speaker, my honourable friend is right to point to the distinction of sadly those people that die either with COVID or of COVID. There is a difference, and I have come to this dispatch box before to say it's certainly with the Delta variant. We don't have enough data on Omicron yet, for reasons I'm sure my honourable friend will understand, but with the Delta variant, I'm told by the NHS that it's approximately 20% of those people, certainly in hospital, that have COVID are there because they happen to have COVID versus those that are there because of COVID.
Chris Bryant.
Thank you, Mr. Deputy Speaker. Why are PCR tests so expensive in the UK? Why is the UK the second most expensive place in the world to have a PCR test? Why does the government website still advertise PCR tests for £15 or £20 when they're not available anywhere in the UK for £15 or £20? Why are they still advertising PCR tests when you go through to the company concerned, it ends up being £50, £60, £70, £80, £120, £150 for the test? Isn't there something we can do to get the price of these costs down? Because for a family going on holiday at Christmas or at New Year, you could end up spending £1,000, £1,500 just on the tests.
Mr. Deputy Speaker, the UKHSA has removed many providers or so-called providers of PCR tests from the listing on the government website. They've set a minimum price that must be met so that to try and avoid misleading prices. Unlike some other countries, we have not chosen to subsidise the cost of private PCR tests because I think we have rightly concentrated our resources on the PCR tests that are available for people domestically if they have symptoms.
Anne-Marie Morris.
Thank you, Mr Deputy Speaker. The extended vaccine rollout is welcome to prevent infection, but given this puts even more pressure on resources, what steps has the government taken in tandem to increase capacity in the NHS to address increasing demand from both COVID and non-COVID patients? I know that the army is being brought in. What about Nightingale hospitals? Might they be reinstituted? Will we look again at the pension challenge, which stops people, senior people, continuing to stay in the profession? Will we look at accelerating the training programmes for our health professionals, as they have done in other countries? And will we create new health professionals with shorter training programmes? Action is needed now to deal with this capacity issue.
My honourable friend, Mr Deputy Speaker, is right to talk about the importance of increasing capacity. This pandemic has really acutely brought that front of mind, and there has been significant investment ever since the pandemic started, particularly in certain types of capacity, especially ICU capacity with PPE, with oxygen, and of course personnel as well, with some 10,000 nurses added over the last years, almost 3,000 doctors added. And this is something now, because of the Omicron emergency, that is being revisited about how we can further increase temporary capacity.
Catherine McKinnell.
Thank you, Mr Deputy Speaker. NHS data in November showed that of pregnant women in hospital with COVID, 98% were unvaccinated. Pregnant women want to do the right thing to protect them and their babies, but there's been a lack of clarity and a lack of prioritisation for vaccines for this group of people. So will the Secretary of State set out what the government is going to do to send the message loud and clear that vaccination uptake for pregnant women and their babies is a priority for this government?
Mr Deputy Speaker, it absolutely is, and the work that's being led by Lucy Chappell in particular in my department at the UKHSA, this has been one of the central focuses of her work, to encourage more pregnant women to please come forward and take up the offer of the vaccine. As the Honourable Lady says, sadly, when you look at the pregnant women that are going into hospital because of their COVID infections, almost all of them are unvaccinated.
Alan Cairns.
Thank you, Mr Deputy Speaker. And can I pay tribute to my right honourable friend for the speed and efficiency in which he, the government and the NHS are rolling out the booster programme. But does he share my concern that the programme is being rolled out somewhat slower in Wales? There is no access to walk-in centres, there is no online booking system, and the local health boards are depending on the Royal Mail when the postal system is at its greatest pressure because of Christmas and because of staff off with COVID. So will he agree to share the expertise and capacity that the UK government has built up in the most positive way with the devolved administrations, specifically with the Welsh Government, so that my constituents can receive the same access as his constituents?
Yes, Mr Deputy Speaker, I do very much agree with that. It's UK-wide. This Omicron emergency is UK-wide, and all parts of the UK should respond by increasing whatever they are doing on the booster programme, by increasing it further. I think that that the view is shared, certainly throughout the UK, and we will also be providing more support to Wales, Northern Ireland, to Scotland, to make sure that they can certainly increase their booster programme.
Lillian Greenwood.
Thank you, Mr Deputy Speaker. Testing and self-isolating are vitally important in preventing transmission, but for people in precarious jobs who are really struggling to make ends meet, it can be incredibly worrying and difficult. Why has the government still not fixed sick pay so that everyone is properly supported to do the right thing, including those people who may be worried about getting their vaccination or booster due to possible side effects and needing to take time off work?
Mr Speaker, we of course keep under review the support that is available throughout this pandemic. It's important that the House has decided to extend the fact that sick pay can be available from day one, and also there's a hardship fund that is administered by local authorities.
Dr Luke Evans.
Thank you, Mr. Speaker. And can I commend the Health Secretary for bringing forward the booster and aiming so high to get it out. One of the key things, though, is making sure we have enough vaccinators and staff to be able to do this, as well as volunteers. In that vein, will he ask the ICSs, all 42 of them, to review their bureaucracy around signing people up to do vaccinations, potentially even to allow people to work from GP practice and into hospitals and vice versa? Because practically over the last year, one of the issues is people are turned away or lose interest because of the bureaucracy with regards to paperwork when it comes to vaccinating. Given the challenge ahead of us, I'd be grateful if you consider asking this approach.
My honourable friend speaks with great experience, and he's right to talk of how can the training programme for vaccinators, especially volunteer vaccinators, be streamlined, and that work is going on at urgent speed, both within the NHS, within the ICSs, but also to help further support the fantastic work that St John's Ambulance has been doing in this space.
Vicky Foxcroft.
Thank you, Mr. Deputy Speaker. I've asked the Secretary of State on numerous occasions about antibody testing for immunocompromised people. His answer has been antivirals for when people get COVID. Right? Has he looked into giving immunocompromised people antibody tests so we have a clear picture of who will need the antivirals quickly if they get COVID?
Mr. Deputy Speaker, my understanding is that for the immunocompromised and clinically extremely vulnerable, that antibody tests are available if that's what their consultant believes is necessary.
Dr. Andrew Morrison.
I declare my interest as a vaccinator. I support the level of ambition that the Secretary of State has articulated, but would he distinguish between being offered a jab and actually getting the jab? You can be offered a hip replacement, but it doesn't mean to say you're going to get it any time soon.
Well, first, Mr. Deputy Speaker, I want to thank my honourable friend for being a vaccinator and all the work he's done to help personally to help the country get through this pandemic. And of course there's a distinction. He's absolutely right. There's a distinction between the NHS being able to offer an individual a jab, so they might receive an email or a text saying, please come forward, either book or walk in, you're eligible. But it does take that individual to come forward themselves and take up that offer. And that is why a huge amount of effort, now even more effort than before, will go into persuading people to come forward.
Derek Twigg.
Thank you, Mr. Deputy Speaker. Can I ask the Secretary of State why the government has no coherent plan for dealing with the delays in elective surgery and treatment? And I say this because I recently put down some parliamentary questions and asked about the impact of the recently announced government funding on waiting times over the past 3 years. But what the Secretary of State said in his answer was no estimate has been made at this time. And then I asked about the estimate has been made about the private sector capacity. Again, no estimate has been made. So as the Secretary of State, where is the plan to deal with this huge backlog of elective treatments? And just say to him that Macmillan estimate that 50,000 there are 50,000 missing cancer diagnoses in the UK and 32,000 waiting for their first cancer treatment in England.
Mr. Deputy Speaker, may I remind the honourable gentleman that the government has already set out, in terms of dealing with the challenge around electives, the biggest catch-up fund for electives that this country has ever seen. There's an extra £2 billion of funding provided in the second half of this year, £8 billion minimum provided over the next 3 years. And the NHS, in terms of a plan, the NHS is working on a detailed plan, and that will be published as soon as it's ready.
Nazgani.
Thank you, Mr. Deputy Speaker. The Health Secretary should be very proud of our world-leading vaccination programme, and I join the Minister in sending out a message to anyone that is anxious to come forward and to get their vaccination. This morning, Breakfast Telly was being broadcast from Baxted, a GP surgery in my constituency of Wilden, and there was huge anxiety how the NHS staff were going to cope with delivering the vaccination. I'm incredibly anxious about I'm incredibly anxious about the SI, about us mandating vaccines for NHS staff, because it means, I believe, 126,000 NHS staff will leave the sector. Is this the right decision to take when NHS staff are already saying they're working all the hours God gives?
Mr Deputy Speaker, we will debate that SI here in the House, and I'm happy to talk more about it then. But what I will say to my honourable friend, I think the number she's referring to is the number of people the NHS estimated at the time the government said it was going ahead with this SI that remained unvaccinated. I'm pleased to inform her that since then it's a smaller number, and tomorrow we will have I will come with the latest numbers that we have. It's improving all the time, and when we did a similar measure for the residential care home sector, we saw the number fall of those unvaccinated day by day as more and more people had positive engagement and took up the offer of vaccine.
Rachel Maskell.
Thank you, Mr Deputy Speaker. When the transmission rate for Omicron is twice that of Delta, when we are asking people to work from home, why are we then saying to people that they can go out and socialise in venues unmasked when the data, contact tracing data from last December show that those social spaces is where there is high levels of transmission?
Secretary State.
Mr Deputy Speaker, it's about having a balanced and proportionate response, and that is what the government has done. And it is about recognising that these restrictions, yes, they help to slow down the rate of spread, but they also have a real impact on people's lives, and it's about being proportionate in that approach.
Theo Clark.
Thank you, Mr Deputy Speaker. I welcome the Prime Minister's announcement that booster vaccines are to be offered to all adults, and I was grateful to receive mine last week at Stafford St George's Hospital. But in order to defeat the new COVID-19 variant, we need to vaccinate as many people as possible. So can I urge the Secretary of State to open a walk-in vaccination centre in Stafford, which we currently do not have?
Well, first, Mr Deputy Speaker, can I congratulate my honourable friend on getting boosted? And secondly, she may have heard me earlier that we're going to open many more walk-ins and pop-in centres, and I've heard her representation, so has the Vaccines Minister, and we will certainly try and make that happen. Mr Deputy Speaker, if I may, just in response to a question earlier from my honourable friend, the member for my honourable friend, member for Winchester, he asked me about the vaccinations proof that I announced earlier for children. And I just want to make it clear, Mr Speaker, that will be, you can order the proof online, but it will be in the form of a letter, but it can be ordered online. The digital pass access will come later.
Kim Johnson.
Thank you, Mr Deputy Speaker. The Contain Outbreak Management Fund is a vital resource used by local authorities and directors of public health. It's due to end in March 2022. So can the Secretary of State confirm whether this funding will continue beyond that date and whether it will be increased to support local authorities?
Mr Deputy Speaker, it's an important fund and I will look into that.
Maria Miller.
Thank you, Mr Deputy Speaker. And can I thank my right honourable friend for everything that he and his whole team are doing in what are incredibly challenging circumstances. And can I bring him specifically back to the issue of access to booster appointments? He set out in his statement, I felt, an indication that the booster rollout was now a national programme rather than being perhaps locally led. Now, our local GPs teams are doing a fantastic job, but will this difference in approach mean that more pharmacies, like the ones in my town in Basingstoke, will be able to be part of the booster rollout in a way that they haven't been able to date?
Secretary State.
Yes, first, if I could say to my right honourable friend, the booster programme, the vaccination programme, it is a national programme, but it is locally delivered. And she's right to point to improving local delivery in her own area by having more pharmacists involved, and I can absolutely give that assurance. Part of our plan is to involve hundreds of more pharmacists, and the good news there, incredibly keen, and that's exactly what I expect to happen.
And Bradshaw.
Can I thank him and his Vaccines Minister for finally sorting the problem of the under-18s being able to access their proof of vaccination, and will he assure me that it'll be operational in time for the end of the school term this week? But on travel more generally, he agreed with me last week that once Omicron became widespread here, that the very draconian, costly and complex travel rules he introduced 2 weeks ago to stop Omicron coming would be pointless, to quote my words. So why are they still in place?
Mr Deputy Speaker, If I can say to the honourable gentleman that first, on the under-18s, the proof of travel for the vaccination proof for travel, as I mentioned a moment ago, that is available from today. So it's available. The individual would go online, or the parent would go online and request it. It comes in the form of a letter, which is something that's perfectly acceptable to all countries that we are aware of that require it. The second issue around the current travel restrictions, I think the honourable gentleman makes a very good point. Given that we already know that the Omicron variant is fast becoming the dominant variant in our capital city, spreading rapidly throughout the country, the justification for having those rules, I think, is minimised. It is something that I have already raised with my colleagues in the Department of Transport, and I do hope that we can act quickly.
Mr Gibson.
Thank you, Mr Deputy Speaker. Can I thank my right honourable friend for the measures to enable travel in the 12 to 15 age group, which is particularly welcome by the Rear family in my constituency, who are travelling tomorrow on what is possibly their last family holiday together. Can I ask my right honourable friend to clarify, if a person is currently isolating today, can they switch to daily testing from tomorrow? And what plans does he have to extend the opening hours of the walk-in vaccination centres, such as that at St Thomas's across the river, which will close at 8 p.m. tonight?
Well, first of all, Mr Deputy Speaker, I hope that the Weir family will have many more holidays. No one wants this to be their last holiday as a family, but I'm pleased that they can go ahead with their plans. They'll be able to access that proof for their children today. On the daily contact testing, I can confirm, if you are vaccinated, so you have to be vaccinated, that if you are vaccinated isolating today, that from tomorrow, subject to the will of the House, so that individuals can move from isolation into daily contact testing. And in terms of the opening hours, certainly for all the large vaccination centres, they will be increased. The minimum will be 12 hours, but many of them will be going way beyond 12 hours.
Liz Twist.
Thank you, Mr Deputy Speaker. With the aim to get such high numbers having a booster through the booster programme by the end of the year, how will the Secretary of State ensure that there aren't inequalities generated by the push for numbers rather than need? I'm thinking of those who may not be able to access digitally the various systems, or those in areas of health inequalities.
Secretary of State. It's a very important point the Honourable Lady raises, because need is more important than the actual overall numbers. Of course, we want to see the numbers increase, but the focus should always be on the most vulnerable first. And the way the NHS will ensure that is the work that's being done, especially by the GPs, that can make homebound visits to care homes, some of the more vulnerable people in society, is that there will be an increased number of those visits.
Andrew Selous.
Isn't the lesson from this pandemic that early and proportionate action save lives, ends up preserving more, not less, of our freedoms, and is actually strongly supported by the silent majority of the British people?
My honourable friend, Mr Deputy Speaker, is absolutely right, and that is exactly the purpose of the plans that we have set out, the measures that we will be debating in this House tomorrow, but also the action that we're taking on the booster programme, which is to get more people protected so they can enjoy their freedoms.
Stephen Pennycook.
Thank you, Mr Deputy Speaker. To my frustration, it was only immediately prior to this statement that I was able to obtain a copy of the regulations we're voting on tomorrow. So could the Secretary of State provide me with clarity when it comes to mandatory COVID passes in two respects? Firstly, will it be the case that an individual can no longer demonstrate their COVID status on the basis of natural immunity via a positive PCR test when it comes to accessing these high-risk venues? And secondly, can you reassure me, for those who don't have access to computers or smartphones, they still will be able to apply for and obtain an NHS COVID pass letter to obtain access to these venues in mind?
Mr Deputy Speaker, in terms of access to the high-risk events, your nightclub or the large events, there will be two ways. The main way will be to take a lateral flow test and get a negative result, and that would need to be registered through the NHS website, and the proof could be through the pass, or it could be a text message result, for example. There will be an exemption from that if someone is double vaccinated, but also the proof of vaccination can also be given through the letter process.
Or Maynard.
Thank you. A constituent of mine has both anaphylaxis and urticaria. She has been told she cannot be medically vaccinated. Amidst all the talk of both second doses and third doses, she cannot access even her first dose. What assurances can the Secretary State give her regarding access to non-invasive forms of vaccination?
It's a very important question from my honourable friend. The rules around the need to be vaccinated, whether it's for passes or otherwise, of course they do not apply to anyone that is medically exempt. There are many people that have received those exemption certificates directly from their GPs. That's the best route. Some individuals have called 111 and received advice. If I could be of direct assistance to my honourable friend, then of course I will help.
Can I take the opportunity to thank the NHS staff and volunteers at the vaccination centres in my constituency, including the one at Aintree Racecourse and the one at Holy Rosary, where my wife and I had our booster jabs in the last few days. And in some communities in the Liverpool City region, there is low vaccine take-up, as there are indeed in communities across the country. The Secretary of State has told us many times from the dispatch box, and his predecessor the same, that nobody is protected until everybody is protected. So will he make sure that the resources go to those areas of the country where vaccine take-up is low, where additional resources are needed, so that our public health directors and teams and the NHS have everything they need to protect everybody through the vaccination programme?
Yes, Mr Deputy Speaker, I agree wholeheartedly with the honourable gentleman, what he's just said there. We've talked understandably a lot in this House over the last hour or so about the importance of the booster programme, but it is still hugely important that we continue to focus on those that currently remain unvaccinated.
Richard Graham.
Mr Deputy Speaker, I welcome the news that a daily lateral flow test will replace self-isolation for those in contact with a COVID case. Welcome the extension of the travel pass to 12 to 15-year-olds, and especially the Health Secretary confirming that a lateral flow test is the clear alternative to being jabbed for access to any venue and any event. So there is no reason for anyone to contact us asking us to vote against a, quote, vaccine passport, unquote. But what would my right honourable friend say to those who've had COVID recently, been told by the NHS they shouldn't have a PCR test for 3 months and then need to travel abroad for work purposes? What should they say when asked for proof of a negative PCR test?
Well, first of all, can I very much agree with my honourable friend with his first set of remarks that this House is not being presented with a vaccine passport. That is not on the table. It's not in any regulation. I don't even know where that particular idea has come from. What the government has been absolutely clear about when it talks about access to nightclubs or to large gatherings, very large gatherings, so very targeted events, that the requirement is to take a free lateral flow test and make sure it's negative. And if you don't want to do that, then you can prove your vaccine status. It's up to that individual. That's what it is. That is not a vaccine passport. And the sooner we get rid of this misleading description of what the government is proposing, the better. On the question that my honourable friend has asked about, I do want to make sure I get the answer to that right. So if he allows me, I want to look into that and get back directly to him.
Just matters.
Thank you, Mr Deputy Speaker. My constituent Lexi is 7 years old. She has heart and lung conditions, which mean that she's clinically extremely vulnerable and has been homeschooled since the start of the pandemic. Her parents are understandably desperate for her to get vaccinated and get back into school. And I understand it's the JCVI's decision as to when this will actually take place, but can the Secretary of State give us some idea as to what information the JCVI are waiting for, when they're likely to make a decision, and whether he is doing everything in his power to hurry them up to make the decision that Lexi's parents so desperately need?
Mr Deputy Speaker, I do understand the situation the Honourable Gentleman has described, and there will be others across the country in a similar situation, so we do understand the importance of this. The JCVI, as he's referred to, is looking at this issue, which I've confirmed earlier, but I will say to the Honourable Gentleman that before we can deploy any vaccine in any particular age group, it needs to be approved by our independent regulator, the MHRA, as safe and effective. At this point in time, we don't have that approval. The MHRA are actively looking at this, but those are the two things that are crucial before ministers can make a decision.
Peter Hobhouse.
Thank you, Mr Deputy Speaker. I too had my booster vaccine last week. It was easy and I had 5 different options near me, but that was here in London, and that was after weeks of unsuccessfully trying in Bath to find anything near me or anything that was convenient with the times that I had available. And that is the experience of all my constituents in Bath. So when will we have services that are available here in London matching those in constituents like mine in Bath?
It's an important point to make sure that capacity is increased throughout the country, and I'm pleased that she's got boosted, by the way, but she's right to say that she should, like her constituents, should be able to get it closer to home with the plans that we've announced recently, but also the plans especially from this morning. I'm confident there'll be many more opportunities to get boosted in Bath.
So I'd like to thank the Secretary of State for his statement today and taking questions for over an hour. We've got a point of order? Point of order. Point of order.
Thank you, Mr Deputy Speaker. And I wonder if I could seek your advice. I've been trying to chase my papers for tomorrow's debate, the SIs that have not been produced in large print for myself. My office and the Vote office have been chasing the Department for Health, and we are not getting a response. So I wonder if you could advise me on how I can get my papers so I can read them in readiness for tomorrow.
Well, I think the Treasury... Oh, further to that point of order.
I'd like to reply to that. I think it's... I've heard very clearly what the Honourable Lady has had to say, and I will get back to the Department right now and chase that up immediately.
There we are. Look at that. Instant solutions. I'd like to thank, though, the Secretary of State for answering questions for over an hour today on clearly a very important subject. We now come to the presentation of Bill. Mr. Richard Fuller. Well done. Well done, everyone. Mr. Richard Fuller.
Hare's closed season bill.
Second reading what day?
Friday the 21st of January 2022, Mr. Speaker.
Friday the 21st of January 2022. Thank you very much. The clerk will now proceed